Hello, I'm Dr. Dimitrios Kostopoulos, co-founder of Hands-On Seminars, and I have with us today Dr. Kevin Okamura, Senior Faculty of Hands-On Seminars, the founder of the program, Certification in Advanced Manipulative Therapy. Kevin, how are you?
I'm doing great, thanks. How are you?
All right, awesome. So just tell us a little bit about you. How did you start physical therapy, and what was your interest about physical therapy to begin with?
My interest, I think, was probably stemming from my days just playing sports growing up as a kid.
What type of sport?
Soccer, volleyball, basketball, golf.
Any major injuries back then?
Ankle, definitely some ankle, some hard tackles. Shoulder, I ended up having shoulder surgery a few years ago, I guess. But mostly it was kind of like seeing teammates get injured, during the course of play, and all of us sort of standing around not really knowing how to deal with it. So I was always kind of interested in being able to offer some assistance and help and not sort of feel like I was kind of this useless bystander when teammates got hurt. So that got me kind of interested in physical therapy as a profession.
And you studied in Canada?
Studied in Canada, the University of Alberta in Edmonton, Alberta, Canada, home of the Edmonton Oilers, of which I'm a massive fan. So.
And how about the interest in the area of manual therapy?
Yeah, the manual therapy interest really started as I was going through the program. I think when I was going through the program at University of Alberta, I had this vision of how I wanted to be as a therapist, and it was someone who could really make a difference with my hands. So when I finished the program, as most new graduates often feel, I felt not that prepared to sort of take on the rigors of working in a private orthopedic practice. So it really made me pursue a lot of continuing education courses with the orthopedic division in Canada. So I achieved fellowship status in the Canadian Academy of Manipulative Physiotherapy.
Which is a big deal.
Several years of training for sure with that, hours and hours of practice, and it was a process. It probably took 5-6 years for sure, at least, to get that process done. So with that, the idea was I wanted to feel like I could offer the most to my patients, as opposed to only being able to offer a narrow scope of practice. I wanted to be able to be the one who could make a difference on several different levels rather than having to refer to another healthcare professional, such as a chiropractor. Not that I'm against chiropractors, but a chiropractor or a massage therapist or a personal trainer. I wanted to be the one who could offer all those services to my clientele.
The title of the course is Certification in Advanced Manipulative Therapy, AMT, right? And this is a Canadian type of approach. What do you mean by that? What is different about a Canadian approach?
Well,
and what do you try to include in that program?
Yeah, it's a good question. So, as I mentioned, I'm a fellow of the Canadian Academy of Manipulative Physiotherapists, and the schooling and the education I received postgraduate was all through the Canadian Orthopedic Association of the Canadian Physiotherapy Association. So, basically, it's looking at meeting international standards. So what I'm a member of is CAMPT, C-A-M-P-T, and they're a member body of IFOMT, which is International Federation of Orthopedic Manipulative Therapists. So with the Canadian approach, it's basically looking at ensuring that we're, thorough in our examination. We're not using higher risk techniques. We're trying to be very safe with a real mind towards patients' well-being. And I think we're just bringing a thoroughness that incorporates a lot of different schools of thought, but we're not necessarily just doing one approach or another approach. We're sort of bringing a little bit from the world of osteopathy, a little bit of the world of some Maitland stuff, but really, we don't really identify so much with either of those individuals. It's just sort of an amalgamation of techniques, what's been proven. We try to be as evidence-based as possible with a lot of the techniques that we do, and it sort of just comes across as this is how we learn things in Canada, basically.